Concern. Tension is a mental condition that shows up in a steady structure because of an individual inclination that there is a danger, and this hazard may as of now exist or be envisioned that doesn't really exist. Tension needs treatment and development on the off chance that it has no coherent or higher than typical reason, and reasons for uneasiness incorporate rehashed dissatisfactions and terrible encounters, youth issues and poor encounters, mental inclination or physical harm. 1. Manifestations of nervousness. There are a few manifestations related with nervousness, and can happen to an individual who is consistently under extreme tension relying upon the person's character and well-being, and the indications can be summed up as follows. 2. Feeling tired. The speed of the heartbeat. Feeling sick. Brevity of breath. Chest torment. Cerebral pain. Stomach torment. Hypertension and expanded race. Pressure in networks and groups of friends. Feeling anxious and furious. Trouble concentrating. Treatment of tension. There are 2 different ways to treat tension, and both might be utilized. 3. Medication therapy, by taking enemy of nervousness drugs and tranquilizers that decrease uneasiness, yet these meds can cause compulsion whenever taken for quite a while. There are likewise enemies of prescriptions. These meds depend on the impact of the activity of synapses that assume a significant job in the improvement of tension and stress issue, and the medication should not be taken until after an authority has been counseled and followed up. Psychotherapy, through authorities in the field of emotional well-being by distinguishing mental meetings that utilization subjective social treatment and strategies for psychotherapy. Absence of rest and its causes. You may have rest issues influencing you, for example, taking hours before resting, dozing and continually awakening, dozing just for a couple of hours, or feeling like never dozing. 4. There are numerous reasons why you don't rest, for example, uneasiness or discouragement, and hormonal changes in monthly cycle in ladies, and a few people experience the ill effects of not dozing or stated on account of the difference set up, in such a case that it moves starting with one spot then onto the next, or travel to a nation or someplace. The difference in natural clock prompts trouble dozing, which influences him adversely. He loses the capacity to focus, he gets drained and tired, and the explanation might be the ineligibility of the spot of rest, and it implies innovation that influences rest or improper lighting forestalls rest. Treatment of rest. Conduct treatment. There are a few kinds of social treatments successful for rest issues, where the creator of the issue can treat himself or through a master. Instances of conduct treatment called Control of Boosts by teacher Richard B. Waite, which is a standards that readjust and wipe out propensities identified with rest issues in the dozing condition. Interfacing bed or bed to rest, for example, hitting the hay just when feeling sluggish, utilizing bed to rest just, not perusing or staring at the television in bed, not eating on the bed, and not eating on the bed, and not stress and stay away from when lying in bed. 6. Subjective treatment alters misguided judgments, and learn better approaches for intuition, including misinterpretations. 6. Misperception of the reason, and an individual's conviction that in the event that you experience uneasiness during the day, this is on the grounds that you don't take enough rest, despite the fact that it might be an issue other than sleep deprivation. Depression, and to expect that one will always be unable to rest enough, and along these lines unknowingly sets himself up for not dozing. Unreasonable desires, for example, expecting a breastfeeding mother to rest for extended periods without awakening her infant, who is familiar with awakening her around evening time. Enhance the results of not resting soundly, for example, believing that somebody will be humiliated at the conference and bomb the following day on the off chance that they don't rest that night. To stress over the procedure of rest and the presentation of the individual, for example, revealing to oneself that it will take hours for him to rest. Every one of these contemplations are balanced in a tough situation dozing as a result of it, and may fall back on psychological social treatment to be progressively powerful. Now and again, your primary care physician may recommend prescriptions that help to rest, particularly in instances of serious sleeping disorder, so the specialist endorses compelling drugs from basic portions for a couple of days. However, a few specialists falter to utilize them over the long haul and be utilized for a brief time frame, and the negative tried to be the reason for the issue, and may cause tiredness during the day. A few kinds of meds are endorsed to treat rest problems. 7. A few meds and extraordinary meds for nervousness that are just recommended by explicit remedies. A few prescriptions explicitly for the treatment of a sleeping disorder and rest issues. A few kinds of antidepressants are explicitly utilized for patients with a background marked by sorrow. A few meds that contain melatonin to direct rest hours, particularly in the older. Some correlative medicines may assist with managing rest and tackle a sleeping disorder issues, for example, needle therapy.